Hello, Assalamualaikum warahmatullahi. I'm Dr. Shahrul Zuraidi Idris. I'm currently the internal medicine physician and cardiologist in Columbia Asia Hospital, Klang. Blood pressure is actually measuring the force of the blood going through vessel wall, and it is measured in a way that it has force to reading. The top is the systolic blood pressure and the bottom is the diastolic blood pressure. The systolic blood pressure actually measures when the heart is actually contracting, and the diastolic blood pressure is actually measuring the heart is actually relaxing. When the normal blood pressure should be below 140 over 90, and who is above 140/90 would be considered as having hypertension or high blood pressure. People who have history of high blood pressure are always a risk, and it can affect mainly the major organs, for example the heart, which can lead towards heart failure or heart attack. Also leads to stroke. Also affect the kidney, causing people to have kidney failure or acute renal disease. Also affect the eyesight, causing visual problem. Two ways to check blood pressure, either by using this blood pressure machine. This is the traditional ways of checking the blood pressure using the sphygmomanometer, where if people go to hospital or clinics, so the doctors or the nurses will put this around the hand and check the blood pressure a couple of times and take the reading. And secondly, most people are using this, but this is just electronic field, so you can just press start and stop and you can read the reading. Few tips and tricks to check blood pressure. You must always try to get at a quiet place, resting at least for about 4 or 5 minutes, not talking. Try to avoid excessive alcohol or caffeine and even foods. Take the blood pressure and try to take about at least 3 readings and take the average blood pressure, in which that can be considered as your current blood pressure. Try to do it 2 or 3 times a day. Most common symptoms that people will feel is actually feeling tired, feeling lightheaded or even giddiness. Sometimes they feel that they're going to faint if the blood pressure is too high. The most importantly is that to know what's your average blood pressure is, especially for the ones who are having risk factors and the ones who are older than 40 years of age. So you need to check from time to time, and I would really encourage people to have at least the automated blood pressure monitoring machine at home. And even though you don't have any symptoms, please do check your blood pressure, because if we know what our blood pressure reading is, we can avoid a lot of complications in the near future, because there's always saying that to say blood pressure is a silent killer. So not knowing that you have high blood pressure can be lethal at the end.